So, John, but there is an outbreak right now, a multi-state outbreak of equine herpes virus infection in the United States. And it's been traced to the Women's Professional Rodeo Association World Finals, which was held in Waco, Texas, in early November. And as of middle of November, there have been at least 16 cases confirmed in horses across Texas, Oklahoma, Louisiana, Colorado, and New Mexico. And so there seems to be very rapid transmission of this virus. So, John, tell me a little bit about this virus. Why is it that something we should be concerned about?
Okay, so here's a case now where we're talking about an animal pathogen that does not affect people. So this is not a zoonotic disease, but it can be a bad one in certain instances with horses. And to start with, it's a herpes virus. So not unlike our human herpes simplex virus, this is a virus that's really common in horses, almost ubiquitous. So horses carry it commonly, and just like our herpes virus or human herpes viruses, most of the time it can stay dormant. It can just sit latent in the nervous system in a horse. But under times of stress, especially if a horse is a show horse or a performance horse and it's traveling, you can have outbreaks of this virus. It can reactivate and reinfect a horse. And it's transmitted through close contact, horses nuzzling each other. It can be transmitted through fomites, which means it could get on a handler's clothing or on their hands. And if they're touching one horse or another, it can spread that way. And so it's pretty infectious. And a lot of times it causes a respiratory disease in horses. Mostly they recover from it and then they're fine. But in this instance, when it progresses to a neurologic disease, which happens when it affects cells along the spinal cord and along the nervous system and causes a severe inflammatory response, then you start to get very severe disease that can be fatal. Horses start stumbling, they're weak, they're uncoordinated, they can have fever, they can go down. And when horses go down, that can be very serious. And so this can lead to really serious health problems and even death in horses when it gets to the neurologic stage.